Good morning everyone. The topic for today's lecture is growth spurts and factors affecting growth. So what is growth and development? So growth and development though are closely related terms, but they are exactly not synonymous. In conversational English, growth usually refers to an increase in size and tends to be linked to more of change. Growth usually refers to an increase in size or number. The term development, however, refers to increase in complexity. Development carries an overtone of increasing specialization. So growth is largely an anatomic phenomena, whereas development is a physiologic and behavioral phenomena. What are growth spurts? Now growth spurts are periods of sudden increase in growth, which are referred to as growth spurts. The cause is physiological alteration in hormonal secretion of hormones. Various growth spurts are: the first one happens just before birth, 1 year postnatal. The third one occurs at mixed dentition stage at 8 to 11 years in boys and 7 to 9 years in girls. The fourth one is prepubertal growth spurt, which is the most important for orthodontic purpose and happens in 14 to 16 years for boys and 11 to 13 years in girls. So clinical significance of this refers to growth modification and timing of surgical correction. Now most of the growth modification procedures can be carried out during these prepubertal growth spurts. If not done, then in that situation surgery is the only option left for patients. However, sometimes it is also important to know at what age these growth spurts will finish, because if some cases do require surgery, then in those situations the growth should finish and only after that surgical intervention should be planned. This is the Scammons growth curve, which shows the growth of various organs and structures. The neural tissue shows the maximum growth initially, that is up to 5 years of age. The brain grows to its maximum size and then it achieves a plateau phase slowly. So maximum growth of the brain occurs during the initial years. The lymphoid tissue first initially grows up to 200% and then slowly comes back to its 100% of growth over the years around 20 years of age. General body curve follows a S-shaped growth of curve, in which there is an increase, then a plateau, and then again an increase up to 20 years. And genital growth initially is low, but after 10 years it gains momentum and up to 20 years reaches its final position. So what are the various factors which affect growth? The first one is genetics and heredity, because genes usually influence size, rate and onset of growth. There are many malocclusions like class 3 malocclusion, also called as Habsburg jaw, which runs in families, and genetics plays a very important role. Second is nutrition. So effects of malnutrition are reversible, but catch up if effects not too severe. So mostly happens that if somebody takes a proper diet and nutrition, then whatever growth has not occurred can come back to normal. Third is illness. So prolonged debilitating illness can also have a marked effect on growth. So sometimes different mumps, measles and other diseases can affect the initial growth, and therefore if proper nutrition and other things are given at a later date, patient can catch up. Next also important factor is race. So it works along with nutritional and environmental factors. American blacks have calcification and eruption of teeth a year earlier than their white counterparts. So there are different variations according to race. Sometimes malocclusions are also very particular of a different race. For example, bimaxillary protrusion is very much commonly seen in American blacks, but not that frequent in the American whites. Socio-economic factors. So children in affluent and favorable socio-economic conditions show earlier onset of growth events. So their nutrition and other things are already available, and therefore they show early growth spurts. Family size and birth order. The firstborn babies weigh less at birth, are of smaller stature but higher IQ. Smaller the family size, better is the nutrition and other favorable conditions. Secular trends: change in size and maturation in large population over time. So due to changes in socio-economic conditions and food habits, so these also play an important role. Climatic and seasonal variations. So seasonal variations affect adipose tissue content and weight of newborn babies. So definitely sometimes those who are born in very cold climate and sometimes those who are born in warm humid weather have different traits. Psychological disturbances. Now stress plays a very important role in all the kinds of malocclusions, and stressful conditions can also cause inhibition of growth hormone secretion and growth retardation. Lastly, exercise. So motor skill development, increase in muscle mass is associated with exercise and therefore helpful in growth. Thank you.